43,000 deaths, 40,920 deaths, and 40,610 deaths. These are coming from the years 2019, 2018, and 2017. Was this from the war? No. Was this from a famine? No. Was it from a communicable disease? Not quite. These numbers are derived from ductal carcinoma, which is also known as breast cancer. Now, breast cancer is not the most terminal cancer amongst everyone, but it is amongst women. Ductal carcinoma is a leading cancer for women and has a 12% mortality rate. Now, because malignant cells bunch up to obstruct the lymph nodes in the breast tissue, most women won't notice that they have breast cancer until they already developed a strong form of it. And women will go untested for breast cancer and are usually the ones who have a risk of developing it over time. Now, to keep the speech short and concise and straight to the conclusion, I'm going to deliver the speech in 3 points. First one's going to be stats and information. The second one's going to be about the treatments, which is going to weigh the pros and cons. And third is going to be what can we do as people to help encourage those who have already contracted the disease or may contract the disease. So let's start off. Breast cancer affects 1 in 8 every woman in the United States. That's 12% of the female population. Now, think about all the women you know at your church, at your job, at a restaurant, or anywhere you be where there would be women. 1 in 8 of those women of that population are going to contract breast cancer or ductal carcinoma. Now, there's 2 types of breast cancers: ductal carcinoma invasive, ductal carcinoma non-invasive. Now, invasive basically means that it has went into the lactation ducts. And when it gets into the lactation ducts, it has access to almost anywhere inside the body, and it's invading other places inside the body. Now, that's the most deadly kind of breast cancer. It's also the most common that we see. The second one is non-invasive, which means it's just inside the tissue. Most of the cases, these tumors could be benign, which means non-cancerous, but in other cases, they can be known as malignant, which means cancerous, and they can be very deadly as well. Now, the invasive has about 200,000 deaths overall since 2007, but the non-invasive only has about 38,000. Now, we have seen an increase overall in breast cancer deaths from 2007 to 2019, but we also noticed a percentage drop in specific at-risk groups. African American women are at the highest risk to get ductal carcinoma, and their percentage has dropped from a 17% to a 16.4%. So that's good, because we know that our public health professionals are starting to get the other people who are not getting tested, getting them into those offices and letting them know if they have it or not, so that they can start controlling it at an earlier stage. Now, we're going to talk about some of the treatments. The bone marrow transplant is basically when you go into the femur, which is the bone inside your leg, that's where the red blood cells are created, and you're going to try to manipulate those red blood cells, replace the bone marrow, and put brand new ones inside there so that it can create brand new fresh red blood cells and flush out the cancer cells. Now, this could be a deadly kind of transplant because the femoral artery is also within the exact same bone. So any puncture to that artery could lead to almost instant death through bleeding out. Another one is chemotherapy. This is one of the more common ones. We see that it literally zaps tumors inside the breast. Now, it could destroy every single cancer cell in the body. Now, that sounds great, right? But actually, it could destroy the good ones too. Now that it destroys the good ones, you will have no immune system for whether it might be days, weeks, months, and most cases, years. Cryotherapy is a form used for non-invasive breast cancer. It's basically for people who may have benign tumors, but they just want to be sure they want to get rid of them. So they put you inside of a chamber and go sub-0 degrees, and they try to freeze it off. When you add heat to something, it expands. When you add a cold compress or cold air to something, it's going to shrink. And with the shrinking the nuclei inside the cell and literally stopping all functions, and because all chemical reactions stop below 0 degrees. So that would be a good one, but if you don't have a benign tumor, they're all malignant, that's not going to be very much help to you. Another one is hormonal transplant. Now, a hormonal transplant from getting male hormones, putting them into a female, it could be good because men have a lower chance of getting ductal carcinoma, even though they can still get it. It helps you raises your metabolism, and you start to lose more weight. And weight causes a lot of ductal carcinoma inside of women. So that could be very helpful to you as well. The only bad thing about it is that it masks the effects and it masks the signs and red flags of ductal carcinoma. So you can get off the treatment and you still may have stage 4 breast cancer, but you would have never known it. And the last treatment is surgery. Now, surgery is also a very common one, but we also see that with surgery, there could be botched surgeries, there could be good ones. It really just depends on where the tumor is in your breast. If it's in situ or if it's invasive, it's going to be a little harder because it may have already reached to other spots of your body. Now, if it's non-invasive, it's going to be pretty easy to take it out. And that's where most cases, if it's non-invasive, most women actually get it surgically removed and then try to forget about it unless they go into remission. So what can we do as people who aren't at risk to help out these people? Well, we can encourage them. We can give them high hopes that, hey, you're gonna beat this. You've got this. You got great doctors, and we're gonna be in this together. And that's another thing, is try and being there for the long haul. Don't abandon your friends just because of this disease and because it might be a burden to you. No, help them out, because it's gonna help them feel that they're appreciated and that they have someone sticking it through with them. Study about the disease as well. That's another thing we can do. Studying about it. Don't just give out false information and don't read false information about it. Really, really study what you're going over. And then raise awareness. Raising awareness is a great thing because it can help raise funds to find a cure for cancer. So if you know anyone in this battle, please help them know that they are loved, that they are appreciated, and that they are going to get through this. Now, we all, like I already said, breast cancer is not the most detrimental cancer out of all of them, but it is in women. And women honestly help make up our population. Without a woman, you and I wouldn't be here. 43,000 deaths in 2019, 40,920 deaths in 2018, 40,610 deaths in 2017. No more. Let's start working together so that our at-risk populations can have a chance at a better life. Thank you.